Disturbing projection from the World Health Organization. The Omicron coronavirus variant will likely infect half of Europe's population within 6 to 8 weeks. Just take a listen to what the WHO's regional director for Europe has said.
Today, the Omicron variant represents a new west to east tidal wave, sweeping across the region on top of the Delta surge that all countries were managing until late 2021. The region saw over 7 million newly reported cases of COVID-19 in the first week of 2022, more than doubling over a 2-week period.
That tidal wave, quote, is headed towards Eastern Europe, of course, too, with some of the region's lowest vaccination rates. Still, despite record-breaking numbers of new cases, the WHO Europe insists schools should be, quote, the last place to close and the first to reopen. For more on the spiralling situation in Europe, I'm joined by senior medical correspondent Elizabeth Cohen. Try telling parents that, Elizabeth, these are frightening, frightening numbers.
They certainly are. These numbers are very frightening. And I know that there's been a lot of talk about, will COVID-19 become endemic? And this was discussed at the World Health Organization press conference today. And one of the things that one of their officials said is that they don't think it's endemic yet. That has not happened yet. Endemic would mean that it's sort of a part of our world forever, presumably, and that it follows a predictable pattern, kind of like flu is endemic. So while they don't think it's endemic yet, still, these are very difficult numbers. I know people are nervous as they send their children to school. One of the things that we do need to remember is that while Omicron numbers are very, very high, that the illnesses do tend to be mild. Julia?
Yeah, that's a very important point too. And I think for people watching this who are thinking, wow, 1 in 2 of us over the next 6 to 8 weeks, if you're watching from Europe, is likely to get Omicron. What more can they do to protect themselves? I know in the United States that the CDC is talking about potentially coming out and telling people that they have to wear more significant masks, what we call the KN95s or the N95s. What's going to be the message on that? And what did the WHO say about that?
So the Washington Post is reporting that that's being considered by the CDC to tell people or suggest to people wear a KN95 or an N95, but no one else has reported that. So it's unclear if that's accurate or not. One thing that is clear, I think, is that N95s or KN95s, that they really are, they do the best job. Let's take a listen to Dr. Anthony Fauci.
Obviously, the epitome of the best masks are the N95s. N95s are less likely to be worn because they are not particularly comfortable. You put an N95 on for a period of time, it is not the easiest thing to wear.
So we just heard from Dr. Fauci, one of the downsides of N95s. Another one is that they can be hard to find. And when they are hard to find, you want to reserve them for healthcare workers. So if you can't get an N95 or if you're having trouble wearing one, and if you are, you're in good company, here are some suggestions from the CDC about other kinds of masks and sort of the qualifications. So one, it needs to fit snugly, no gaps on the sides. If there are big gaps on the sides, that means that really kind of like, what's the point? Also, it should have a nose wire so that it could conform rather to your nose. That also helps keep the mask do its job. And no single layer cloth masks. It should either be at least 2 layers or like a surgical mask, which is also multi-layers. Julia?
Yeah, I mean, when I wear a mask properly and I wear one of the thicker masks, I always am reminded to thank our healthcare heroes for how uncomfortable they are and how difficult it is to breathe. And they do it for hours at a time. Any good news, Elizabeth? We've watched what happened in South Africa, in the UK in particular too. If we talk about the United States specifically, do we have any sense of peak cases and when we might see those case loads come down?
Yeah, Julia, we're keeping a close eye on New York in particular because that's where Omicron started to surge, and so that's where we would see it peak first. You know, maybe we're seeing the inklings that it has plateaued and that hopefully it will start to come down soon, but it's too early to say that for sure. And you know, the United States is a very big place, so there are areas where Omicron is just now beginning to surge, and so we really aren't seeing the end of this surge yet. Again, the only sort of bright side to this is that Omicron does tend to give more mild disease. But then the flip side of that is when you have many, many cases. I mean, look at the WHO's forecast for Europe, 50% of people. When you have many, many cases, even a small percentage ending up in the hospital, that's still a big number.
Yeah, it's still a huge burden on the healthcare system. Wear those masks, get vaccinated if you are able. Elizabeth Cohen, thank you so much for that.